Tobacco is still the leading cause of preventable disease and death in the United States. But the good news is that your health begins to improve just hours after quitting smoking. Coming up on Polk Place, we will talk with the Florida Department of Health in Polk County about helping you quit. Make sure you stick around. Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Jessica Napoleon. Jessica is the Tobacco Policy Manager for the Florida Department of Health in Polk County. Welcome back.
Thank you.
I didn't get to do the interview last time, but you said you had a great experience.
Yeah.
And you did make it back, right?
I did.
Pressure's on me this time. Let's talk a little bit about the Tobacco Free Florida and Tobacco Free Polk Partnerships. What exactly is that?
So Tobacco Free Florida is a free service, cessation services for individuals who are looking to quit smoking. They offer free cessation services to all Florida residents, and those services come in the form of either online, in person, or over the phone, depending on how an individual chooses to receive their services. They also have texting services as well as email services. So it's just up to an individual of what's going to work best for them and which route do they want to go to quit smoking. And they're also able to receive free nicotine replacement therapy, or NRT, and that's the patches, lozenges, and gum. So if they sign up for any of those services, they can then receive a free 2-week supply to get them started to help them quit. And to receive those services, they don't have to have started quitting or be in the process. It's just having that thought so that when they are ready to quit, that they'll have a plan in place, and Tobacco Free Florida helps them do that.
Now, how can a smoker improve their overall health?
The most obvious is quitting smoking. As you said, within hours of just quitting smoking, your health begins to improve. And if this past year has taught us anything, it's, we need to protect our overall health. And smoking essentially affects every organ in the body, especially your heart and lungs. And with COVID now out and about, heart and lung disease puts a person at greater risk for serious complications with COVID-19. So quitting smoking, it also the #1 preventable cause of disease and death in the U.S. And, quitting smoking will absolutely help overall health.
Aside from not starting, how does one quit smoking?
So first and foremost, it is designing a quit plan, having a plan in place, as well as accessing proven effective resources like Tobacco Free Florida. A mix of both counseling and medications are, they work well separately, but also together they're more effective. Through the Tobacco Free Florida services, either online, in person, or over the phone, what that essentially is going to help that person is develop a quit plan. And just kind of have it in the forefront of what are their triggers, what can they anticipate coming their way so that when it does happen, that they'll be ready for that and they'll be more successful.
One of the things we want to talk about, where can you find proven effective resources? You talked a little bit about some of the things that you guys offer. What's the easiest way? Where can we find those?
So first and foremost, tobaccofreeflorida.com. You can find all of those resources. Also, what would help tremendously is talking with a healthcare provider, whether it be your dentist, pharmacist, or regular primary care physician. Having that extra support is always, helpful, and especially for your healthcare provider, there are, in addition to the nicotine replacement therapies that Tobacco Free Florida offers, the patches, lozenges, and gum, there are other medications that are proven effective to help individuals quit smoking. And those are the bupropion, I always say that incorrectly, I think it's bupropion, and then the Chantix, and there's also an inhaler and a nasal spray, and those can all be prescribed through your healthcare provider. So there are a lot of different options because we know what works for one person doesn't necessarily work for the next person. So it's finding that right combination of medications and counseling and resources that's going to help an individual.
Something that's coming to the forefront, not only cigarettes, what about e-cigarettes and vaping? That seems to be a popular thing and something even harder to quit.
Yes, so e-cigarettes are not approved by the FDA as a proven cessation method for quitting smoking. However, there have been instances where it has helped individuals who are either, well, first and foremost, not pregnant and completely switch to using e-cigarettes. However, what a majority of people do end up doing is they're using the e-cigarettes and cigarettes at the same time, and that doesn't, we call that dual use. That does not help. It can help some, but again, it's not FDA approved yet. There is no research showing that it is a quit smoking cessation aid. It's actually kind of interesting because the FDA does have an outlet for e-cigarette companies to apply to be considered a smoking cessation aid. And a lot of e-cigarettes do claim that they can help people quit smoking. However, not one e-cigarette company has taken that route of actually applying to be considered a smoking cessation, which I find really interesting. But again, as long as it's an adult, not pregnant, that's completely switching to e-cigarettes, it can help some people, but what we're finding is actually there are more kids and youth who are using e-cigarettes, and is actually getting them into nicotine addiction as opposed to getting them out of it. Youth that haven't smoked or never would have smoked are now trying these products, and now we've ended up with a youth vaping epidemic. But that's a topic for another show.
We got just a little bit of time left.
Sure.
Talk about the importance of quitting. Talk about there's going to be failures with it.
Absolutely.
Talk to me a little bit about that, if you would, and encourage them to keep trying.
Yes, absolutely. So even for individuals who have tried and it just, they haven't been able to find the right tools to help them yet. Even if they have a slip or relapse, we do encourage them try again, and take it as a learning opportunity. Coming as a personal former smoker, it took me probably, I want to say up to 20 tries to actually finally quit. And it's all in just, you learn every time you relapse and you slip about what is that new trigger or what actually caused you to slip up, and then being able to prepare for your next try to, know that that's something that's going to trigger you. And so just keep trying. There's no limit to how many times, you try and quit. And it's actually interesting because there are more former smokers in Florida than there are current smokers. So it is possible. Keep trying. Again, the minute you quit, your body is going to start improving. So don't give up.
Well, Jess, thanks for coming in and seeing us, and come back again and see us soon.
Thank you so much.
Tobacco Free Polk is mobilized to prevent initiation and reduce the use of tobacco products, reduce secondhand smoke exposure, and impact local policy and systems change to improve health and quality of life in Polk County to the residents. Choosing to quit smoking and protecting the overall health and immune systems has never been more crucial than now. Tobacco Free Florida and Tobacco Free Polk Partnerships are encouraging tobacco users to make a plan to quit smoking to improve their health for 2021. If you need more information how they can help you make this healthy change, give them a call, 863-578-2157, or look them up on the web at www.polk.floridahealth.gov.